Hi everyone, welcome back to Beyond Your Knowledge. So today we're going to be talking about Streptococcal pneumonia. But before we continue, I would like to share with you Psalm 136 verses 1 to 3, and says that give thanks to the Lord, for he is good, for his steadfast love endures forever. Give thanks to the God of gods, for his steadfast love endures forever. Give thanks to the Lord of lords, for his steadfast love endures forever. Amen. So we need to be thankful because the Lord endures forever. Amen. And he is good. Now, we are going to be talking about Streptococcal pneumonia. So we're going to give some important points of Streptococcal pneumonia. So first, we can mention that Streptococcal pneumonia, it is a bacteria. And this bacteria, it is a gram-positive bacteria. So let's just have there. It's a gram-positive bacteria. Also, Streptococcal pneumonia, the shape basically is a lancet shape. Lancet shape cocci or bacillus, so it's lancet-shaped cocci, okay? And also, instead of being single, it is in pairs, okay? It is in pairs. I will show you a picture of the Diplococci. So basically here it is, okay? There we go. So yeah, as we can see here, here the arrow, so this is Diplococci, okay? So basically so this is how it looks like, Diplococci in pairs, okay? Cocci in pairs. So this is another picture of Streptococcus, okay? So let's just put it here, okay? So yeah, now let's see what else we can say about Streptococcus pneumonia. Streptococcal pneumonia, well, it's going to cause pneumonia for sure. And also you will see that the cocci, which is in pairs, that I mentioned before, you can find it in the sputum of the patient, okay? So, and also the patients can present with fever. The patient can present with cough, okay? And all those things suggest that the patient has an infection, but we need to check the microscope as well. So because it's from the family Streptococci, okay? Because it is a Streptococci, so remember that the Streptococci are catalase positive, okay? Are catalase positive, okay? A little bit big, but it's okay. Now, well, right now I just so Staphylococcus is going to be to catalase positive, but when we're talking Streptococcus is catalase negative, okay? So yeah, just note it, because it's okay, but no, okay, so thanks to God. So yeah, so it is catalase negative, okay? There we go. So now we don't forget catalase negative for Streptococcus and catalase positive for Staphylococcus, okay? Now we can keep going. Well, because Streptococcus, as I mentioned, is catalase negative, and then you remember that there is an algorithm or logarithm, so that we are going to have the Streptococci, that the Streptococci is going to be or alpha hemolytic or beta hemolytic or gamma hemolytic. So if it's let me just show a picture of this. So here basically is the picture. So streptococci, so as I was mentioning, so we have the alpha hemolytic, the beta hemolytic, and the gamma hemolytic. Okay, now each of those is going to have hemolysis. So if we're talking about alpha, it's going to be partial hemolysis. If it's beta, is complete hemolysis, and if it's gamma, there is no hemolysis. So depending on the hemolysis, is going to present color. If it's partial, it's going to be part green, so it's green. If the beta hemolytic is clear. Now, what kind of microorganism we can find in each of those? Well, the alpha hemolytic, so we're going to find pneumonia and viridans. The pneumonia, so it's going to be optosin sensitive and biosoluble and capsule and positive. While the viridans is the viridans is we have mutants and sanguis. Okay. Now this is optosin resistant, not biosoluble, and no capsule. Well, then if we go to the beta hemolytic, so which is pyogenes is a group A and is basic tracing sensitive, and agalactia is a group B, so basic tracing resistant. And then the no hemolysis in the gamma, we have Enterococcus, so we're going to have the E. faecalis and Faecium. Well, so basically this is a summary of that. So I have another video with more more details, or I was drawing and everything. So yeah, so probably you can go forward with that one. But yeah, so let's just continue because we're now going to talk about the streptococci. So we already mentioned a couple points, a few points. So like is the gram negative, catalyst negative. Also, it is going to be alpha hemolytic. Okay, now the alpha hemolytic, because degrees of the hemolysis on blood agar distinguishes the hemolytic, is going to be partial, as I mentioned, or complete from non-hemolytic streptococci. The biosolubility and optogen tests are used to differentiate between the partial green hemolytic. Okay, so as we mentioned here. Okay, now the Streptococcal pneumonia and viridans, so are those that we mentioned already. Now autolysin produced, so let's just autolysin produced by Streptococcal pneumonia is activated by bile. So let's just talk a little bit more. So what is activated by bile? So activated bile, so the autolysin, so there we go. So the autolysin, so autolysin produced by Streptococcal pneumonia. So that means that the Streptococcal pneumonia produce this autolysin. Okay, let me just abbreviate pneumonia. Okay, strep. Well, is activated by bile. Okay, now, and if it's autolysin, which is produced by Streptococcal pneumonia, is activated by bile. So what do you think that is going to be the result? So it is equal, or the result is a cell lysis. So there's going to be a rupture of the cell, because lysis basically is rupture. And if you see autolysin, so lysis, cell lysis. Okay, now therefore addition of the bile cells into the tube with Streptococcal pneumonia, so growth turbid. So when you check the tube is going to growth turbid. Okay, so that's mean that leads to cell lysis and clearing of turbidity. This is known as a biosolubility. Okay, so that's mean that when this addition of the bile cell into the tube with the Streptococcal pneumonia growth leads to cell lysis. So and then cell leads to cell lysis, and so, and then this is clearing. You have to read this, and then this is not about solubility. Okay. Now, what else we can mention here? So Streptococcus pneumonia, that means it's a bile soluble and obtusing sensitive, as we mentioned here. So Streptococcus pneumonia is obtusing sensitive and it is a bile soluble. Okay. So, and obtusing sensitive, yeah. So while the viridans, we can come back here. While the viridans, this one here, it is obtusing resistant and it is not bile soluble. Okay. So just to close, just pretty fast. So Streptococcus pneumonia, it is a gram positive. It is an alpha hemolytic. Okay, an alpha hemolytic. It is an obtusing resistant or sensitive. It is sensitive. Yes, it is sensitive. Good job. And it is going to be, how is going to be the bile? So the bile is going to be soluble. Okay, soluble. And it's going to see how many cocci is in pair or no pairs. Yeah, it is Diplococci. Okay, so Diplococci. Now, so basically this is, which one is this one? Streptococcus pneumonia. But if you remember, there is another one which is going to be Streptococcus viridans, and Streptococcus viridans basically is the opposite. I mean, besides to be is a gram positive similitude, it is going to be also alpha hemolytic. So this is the same, alpha hemolytic, but we need to look any difference between both. Okay, and what is the difference? So obtusing viridans is resistant. Okay, viridan is resistant, and the bile is insoluble. Okay, and the bile is insoluble. Okay, and so basically is that with this one, with Streptococcus pneumonia and Streptococcus viridans. So, but now that was the alpha hemolytic. So inside of the Streptococcus, the other is beta hemolytic. So in the beta hemolytic, so we're going to have two as well. So we're going to put it here. So one is called Streptococcus pyogenes. Okay, and then the other one is going to be a Streptococcus as well, because we're talking about Streptococcus agalactiae. Okay, excuse me, agalactiae. Okay, so now what is the difference between each other? First, Streptococcus pyogenes is group A Streptococcus, which is abbreviated gas, while the Streptococcus agalactiae is a group B Streptococcus, which is more common in babies, neonatal, all those things. Okay, now how can I identify those? How can I differentiate those? So I'm going to do a test, PYR test, in both PYR test. So, but why PYR stand for? So I will let you know pretty fast. So P stand for pyrrolidonyl. So P stand for pyrrolidonyl. Okay. So pyrrolidonyl arylamidase. There we go. Arylamidase. Okay. This is an enzyme. Now, I do both tests. Oh yeah, but how can I differentiate if it's Streptococcus pyogenes or agalactiae? I do the one. So, but the one that is Streptococcus pyogenes is going to be positive for the PYR test, while the Streptococcus agalactiae is going to be negative for the PYR test. So I'm probably say, okay, but do you have any more different something more that I should learn? Yes. So also we can check basic tracing. Basic tracing we use only in this case for the for the Streptococcus pyogenes, and it's going to be sensitive, okay? And it's going to be sensitive. And but the thing doesn't stop here. So because Streptococcus alactiae has something more that we can check, and it's going to be the CAMP, and the CAMP is not cyclic adenosine monophosphate. It's not CMP. It is a test. So what kind of test it is? So basically it has a names of humans. Oh yeah. So C is for Christie. Okay. So C is for Christie. So which are these women's names. So A is for Atkins, and that is an app, so which is similar to that name. Yeah, so C is for Christy, A is now M. Oh yeah. So M is for Munch. Okay, so Munch, and P is for Peterson. Okay, so Christy, Atkins, Munch, Peterson test is CAMP in this case. Okay, now this CAMP is going to be positive. Okay, it's going to be positive. Okay, it's okay now positive. There we go. Whoa, yeah, it's going to be positive now. So basically, so group B Streptococcus within babies can cause neonatal sepsis, can cause pneumonia, can cause meningitis, can cause UTI, urinary tract infection. Okay, and don't forget BB for babies, neonatal. Now, what about Streptococcus pyogenes? Pyogenes cause cellulitis, also cause pharyngitis. So attack your pharyngitis, inflammation of the larynx, and also can cause erysipelas. Okay, so basically those are the causes, and yeah, sounds good. I think sounds good. But what about in the alpha hemolytic? We didn't mention the disease. So, but just come back because we saw the classification. We started with the disease. We started with beta hemolytic. Now let's just come back again to the Streptococcal pneumonia. So those are the alpha. Okay, hemolytic. And now, so what are the diseases? So Streptococcus pneumonia can cause, makes sense, pneumonia, because the word say we'll just have, that one is a free point. Can cause meningitis, otitis media, and sinusitis. So will be the mnemonic PMOS, and then meningitis, otitis media, and S is for sinusitis. But what about Streptococcus viridans? Streptococcus viridans, so basically saying that I think in viridans, I think in teeth. So I think in teeth, and V for valves, because we have valves in the heart. And why I'm saying that? Because so dental caries, and then if the patient has any dental work, after the dental work they can get subbacterial endocarditis and subbacterial endocarditis after dental work. Okay, sorry. So I think that basically is that. And remember that this is a good topic, and we can do all things through Christ who strengthens us. And don't forget that we need to be, we're more than conquerors in Jesus Christ. God bless. Thank you.